Good morning, ma'am. I am Manito Anjali Villa Cruz from VSN 22, and today I am going to report our um, booklet, which is entitled Kidney Walk, a guide for stone-free path. So this is the first page or front page of our booklet, and the back page, which contains the patient's basic information and the contact for the patient. Next is what is renal calculi. Renal calculi or kidney stones are solid masses made of crystals. Kidney stones usually originated in your kidneys. However, they can develop anywhere along your urinary tract, which consists of these parts: the kidneys, ureters, bladder, and urethra. Kidney stones are one of the most painful medical conditions. These causes of kidney stones vary according to the type of stones. So, there are various types of kidney stones. Not all kidney stones are made up of the same crystallized. They differ. Types of kidney stones are include calcium. Calcium stones are the most common. They often made of calcium oxalate, though they can consist of calcium phosphate or malate. Eating fewer oxalate-rich foods can reduce your risk of developing this type of kidney stone. High oxalate foods are potato chips, peanuts, chocolates, and dates. Next is kidney stone from uric acid. This type of kidney stone is more common in men than in women. They can occur in people with gout or those going throughout chemotherapy. Next is stravite. Stravite is a type of kidney stones found mostly in women with urinary tract infection or UTI. These stones can be large and cause urinary obstruction. They result from a kidney infection. Treating an underlying infection can prevent the development of stravitite stones. Next is recognizing the symptoms and signs of kidney stones. So, kidney stones are known to cause severe pain. Symptoms of kidney stones may not occur until the stones begins to move down to the ureters. This severe pain is called renal colic. You may have pain on one side of your back or abdomen. In men, pain may radiate to the groin area. The pain of renal colic comes and goes but can be intense. People with renal colic tend to be restless. Other symptoms of kidney stones can include blood in the urine, red, pink, or brown urine, vomiting, nausea, discolored or foul-smell urine, chills, fever, frequent need to urinating small amount of urine. Next is testing for and diagnosing kidney stones. Diagnosis of kidney stones requires a complete health history assessment and physical examination. Other tests includes blood tests for the calcium, phosphorus, uric acid, and electrolytes, urea nitrogen or the BUN, and creatinine to assess kidney functioning. Urinalysis to check for crystals, bacteria, blood, and white cells. Examination of past stones to determine their type. The following tests can rule out obstruction: the abdominal X-rays, intravenous pyelogram, retrograde pyelogram, ultrasound of the kidney, as prepared, test and MRI scan of the abdomen and kidneys, and abdominal CT scan. Why kidney stones can be a problem? Stones don't always stay in the kidney. Sometimes they pass from the kidney into the ureters. Ureters are small and delicate, and the stones may be too large to pass smoothly down the ureter to the bladder.
Hi ma'am, I'm Abigail B. Dahilig from BSN 22, and today I'm going to discuss what are kidney stones. So, kidney stones are hard collections of salt and minerals, often made up of calcium or uric acid. They form inside the kidney and can travel to other parts of urinary tract. Stones vary in size. Some are as small as the period at the end of the sentence or a fraction of an inch. Others can grow to a few inches across. some kidney stones can become so large they take up the entire kidney. Here are 8 signs and symptoms that you have kidney stones. First is pain in the back, belly or side. Second is pain or burning during urination. Third, we need to go for blood in urine. Fifth, cloudy or smelly urine. Sixth, going a small amount at a time. Seventh, nausea and vomiting. And last is fever and chills. For the bottom line too, kidney stones are hard collections of salt and minerals that form in your kidneys and can travel to other parts of your urinary system. Stones can cause symptoms like pain, trouble urinating, cloudy or smelly urine, nausea, or vomiting. Some stones will pass on their own. Others need treatment with sound waves or surgery to break them up or remove them. Call your doctor if you have any symptoms of kidney stones. Get medical help right away if you have these symptoms, which could indicate that you have an infection or other serious complication. Number 1, pain so severe that you can't get comfortable. Second, nausea, vomiting, fever, or chills with the pain. Third is blood in your urine. And fourth is trouble urinating. The most common symptoms of kidney cancer are blood in the urine, lower back pain, a mass or lump around your abdomen, anemia and fatigue, unexpected weight loss. And for the risk and prevention, some individuals are more likely to develop kidney cancer than others. Risk factors include age, smoking, obesity, high blood pressure, treatment for kidney failure, certain genetic or hereditary factors, male gender. Certain steps can be taken to prevent or lower your risk for kidney cancer. For example, you can manage high blood pressure with lifestyle changes and medication. Maintain a healthy weight and diet, and don't smoke. And also, we need to avoid frequent exposure to harmful carcinogenic substances can also decrease your chances of developing kidney cancer. So for kidney prevention, we need proper hydration is a key to prevent measure. The Mayo Clinic recommends drinking enough water to pass about 2.6 quarts of urine each day. Increasing the amount of urine you pass helps urine flush the kidneys. And also, you can substitute ginger or lime soda and fruit juice for water to help you increase your fluid intake. If the stones are related to low citrate levels, citrate juice could help prevent the formation of stones. Eating oxalate-rich foods in moderation and reducing your intake of salt and animal proteins can also lower your risk of kidney stones. Your doctor may prescribe medications to help prevent the formulation of calcium and uric acid stones. If you have had kidney stone or you're at risk for a kidney stone, speak with your doctor. Letter O, we need staying hydrated is the key. Number 1, water. When passing a stone, upping your water intake can help speed up the process. Strive for 12 glasses of water per day instead of the usual 8. Once the stone passes, you should continue to drink 8 to 12 glasses each day. Dehydration is one of the main risk factors for kidney stones. And the last thing you want is for more to form. Pay attention to the color of your urine. It should be a very light, pale yellow. Dark yellow urine is a sign of dehydration. Second is lemon juice. You can add freshly squeezed lemons to your water as often as you like. Lemons contain citrate, which is a chemical that prevents calcium stones from forming. Citrate can also break up small stones, allowing them to pass more easily. A great deal of lemon would be needed to make a huge effect, but some can help a little. Lemon juice has numerous other health benefits. For example, it helps inhibit bacteria growth and provides vitamin C. Third is basil juice. Basil contains acetic acid, which helps break down the kidney stones and reduce pain. It's also full of nutrients. This remedy has been used traditionally for digestive and inflammatory disorders.
So, good day. I'm Dr. Dagio from Carbohydrates Group 2, and for today, I am going to present our diet calculation. So first, of course, we needed to compute the total energy allowance. So for the given, we have a female client which ages of 45 years old. The height is 5'1" feet, and if it is converted into inches, it becomes 61 inches. Then for the weight, she's weighing 50 kilogram, and for the basal need, female needed a 0.9 kcal per kilogram. And in getting the desirable body weight, of course, we will be using this BROCA method. So in getting the desirable body weight, we will be using the conversion of the height into centimeter, which is 154.94 centimeter. So for the computing the desirable body weight, we will be going to minus the 154.94 centimeter into 100, and for the answer it is 54.94. Then we will be needed to get the 10% of the 54.94. So 54.94 minus 4.22 is equals to 50.72 kilogram. And if we will round off it, it will become 51 kilogram. Then for the calculating the basal needs, we will be going to use the 0.9 kcal per kilogram, which is the basal needs of the female, times 51 kilogram, which is the desirable body weight, times 24. Then the answer will be 1101.6, or if it is round off, it will become 1102 kcalories. Then for the estimate physical activities, we will be going to use the 45%, which is the light activity, under the light activity. So in computing the total energy allowance, desirable body weight times activity factor. So 51 kilogram, which is the desirable body weight, times 45.0, which is the activity factor, is equal to 2,295 kcalories per day. So the client should consume 2,295 kcalories per day. Then for the calculation of the number of grams of the carbohydrates, protein, and fats, by dividing the calories for each nutrient by the corresponding physiologic fuel values. So the summary, we have computed for this, so we need to have 340 grams in carbohydrates, then 60 grams to proteins, and 50 grams for fats. And this will be this is the one that we'll be going to use in the diet prescription. And that's all for the diet calculation.
Good day, ma'am. I'm Cesar John C. Abenido, and for our meal plan today, we have prepared the patient's lunch. Since patients with renal calculi are advised to take high in fiber diets, citrusy fruits, and drinks that may cleanse the kidney, we have prepared 1 cup of rice, which is 1 exchange for carbohydrates. We have our ginisa na ampalaya, which is 1 exchange for vegetables, 2 exchanges for fruits, which is the apple and the orange as well. And for our drink, we have our high fiber pineapple juice. So also patients with renal calculi are advised not to have a large amount of intake of salts and fats as well. That is why this is the lunch that we have prepared today. Thank you very much.